Welcome to New York Nonprofit Media. I'm Jeff Stein, and I'm here with Gabrielle Fialkoff, the Executive Director of the Office of Strategic Partnership,
Yes.
and here on behalf of the Mayor's Fund. Really great announcement this week about a $30 million program specifically for mental health services for low-income New Yorkers. It's going to represent a very large public-private partnership, bringing together the city side, foundations, and obviously connecting with a number of community organizations. So it'd be great to hear about the whole genesis of the program,
Right.
and also announcements as they are coming along.
Yeah. Well, thank you so much for having me.
Yeah, absolutely.
And to talk about this very exciting partnership. It is called Connections to Care, and it is a partnership with the Corporation for National and Community Service, federal agencies, their Social Innovation Fund. So it's a $30 million partnership between CNCS and the Mayor's Fund, and we'll be partnering with local community-based organizations. It is really a grant that came out of the need to increase mental health services access for low-income New Yorkers. And it will be a study, a 5-year study, where we will train staff in community-based organizations like an early learn center or an employment center to while they're working with their clients, understand the signs of mental health stress, and to give counseling and referrals and training lay staff in techniques that early evidence shows has positive outcomes in decreasing mental health issues, but also increasing success in employment, decreasing hospitalizations. There's a lot of interesting early data. So
Decreasing incarceration.
Decreasing incarceration, certainly. So we'll be partnering with about a dozen community-based organizations who will form a partnership with a mental health provider who will train their staff and stay involved in ongoing ways and monitoring how they do very closely.
Yeah. So just to provide a little bit of insight for the viewers, what is the general roadmap, timetable of the program? I'm sure a lot of people will be interested in getting involved and finding out about it. Yeah.
We will be putting out an RFP in September and asking for applications and responses from our community-based organizations and their mental health provider partner. And we will be evaluating those through the winter and hope to launch in the spring. So it's very exciting. It's very fast-moving.
Yeah.
We'll have about a dozen partners. And what's particularly interesting is that we're going to have different types of providers. And so we really encourage anybody with an innovative idea in this space. We're looking for interesting programming, new ideas, and a commitment to addressing mental health issues for New Yorkers, particularly low-income New Yorkers who truly lack enough services and adequate services.
Great. Yeah, I'd love to get your thoughts on, bringing together the different spheres and players in this space to, affect positive change for New Yorkers. Obviously, community-based organizations, nonprofits, and the philanthropy side, and also government. What are the challenges and also the rewards of bringing together all of those players?
Yeah, we established my office, the Office of Strategic Partnerships, when we came into office a year and a half ago, and we really saw a need of a connection between government, nonprofits, and the private sector. And, thinking about that coming together of public-private partnerships as a new way to change the lives of New Yorkers and our citizens, and not only test innovative new programming, which is important, but to also use the scale of government. What we have is the scale of government. What the private sector brings is a flexibility of funding funding and speed, and we have this incredible knowledge base in our nonprofits and track record. And so bringing them together has been, I think we've had some really interesting successes to point to. Certainly this grant being the biggest that we're proud to announce thus far. But we really hope that this office can serve as a national model as well for a new way to do government, if you will, and a new thinking about it, and not just thinking government solely, but bringing together the resource, particularly New York City. We're in the commerce capital of the world, and we've got incredible corporate citizens and corporate partners and New Yorkers who are so generous, and I would imagine one of the largest or the largest nonprofit community in the country. So bringing it together, is just such a way to leverage resources and assets in a new way.
Yeah. We spoke before the interview about the overarching policy ideas. Why mental health? Why is this such a the first real issue that the Mayor's Fund is trying to tackle?
Yeah, well, a few reasons this came to be as our main issue. Certainly the First Lady, Shirley McRae, who is the chair of the Mayor's Fund, her personal experiences have shaped, her desire to be involved in this issue, and she's spoken quite a bit about parents who suffered from depression, and Chiara de Blasio, their daughter who has suffered from substance abuse, is in recovery. So it's a very personal issue. And then we look to the larger landscape of what is happening in our city and public policy, and addressing it from a criminal justice point of view, from a homelessness point of view, from a medical point of view. The First Lady loves to say that 1 in 4 New Yorkers has mental health issues, and or I think it's 1 in 4 New York in the statewide. If it were the flu, that would be unacceptable. And so we have to start thinking about mental health in a more broad context as affecting everything we do. And we think about opportunity and access. We think about how to address the inequality crisis, the income inequality crisis. And if you have mental health issues and it's keeping you from work, of course, or affecting your family, affecting your education, those are underlying issues we've got to deal with. And so from a public policy point of view, from a public partnership point of view, we see this as really, touching every area of the work we want to do to address income inequality.
Great. And maybe as a final question, what sort of advice do you have for nonprofits who are both looking to get involved in this specific, the Connections to Care program, but just sort of more broadly, connecting with the aims of the mayor and dealing with the health and human services crises of the city? Yeah,
I think for this, for Connections to Care, we are, as I mentioned, really looking forward to hearing from the many wonderful nonprofits in the city and doing interesting, innovative, important work. I encourage everybody to call the Mayor's Fund. It's online. And get involved and find out how to participate in the RFP. We welcome, everybody's interest. And from a broader point of view, certainly there are so many critical issues in our city, and it is a crisis. There's a mental health crisis, for sure, that we want to address, and asking people to stay involved, get involved. So we work with so many incredible partners, contract partners throughout every city agency, and staying connected to the city and what we're doing, I think, is how we truly achieve success on the public policy side. So, we see the nonprofit community as integral to our work, and it is and has to be.
Great. Well, thanks so much for coming and sharing all of this information with us, and we'll be excited to see where the program goes.
Good. Thank you so much. Appreciate it.